if you look across studies, what you notice is that most of risk factors for post-epilepsy are factors that are directly related to the stroke. Okay, so and the most important one is the not most, I mean some of the most important ones I would say the location of the stroke. Any stroke that is cortical versus subcortical carries an increase of post-stroke epilepsy. Similarly, a severe stroke also linked to an increase of epilepsy, and which can be assessed using scales such as national the NIH stroke scale. The other important risk factors is it's not directly a I would say, I would like put it, if you have an early seizure, that actually multiplied by 7, you are risk of having post-stroke epilepsy. So having an early seizure it's a red flag that you may go on and develop late onset epilepsy. Other factors include things like hemorrhagic transformation. When you have a stroke that turns into a bleed, and then ischemic stroke that turns into a bleed, that will increase your risk of developing post-stroke epilepsy. Not to not to forget to mention the fact that in some studies, it's been shown that age plays a role. A large risk of disease plays a role as well. And and more recently, having microbleeds, that is pre-existing microbleeds, which are tiny chronic bleeds in the brain, increase your risk of having late onset epilepsy by 2 to 3 fold. And there have been models that were developed to predict post-stroke epilepsy. One of the most popular model is what we call a SELECT model that was developed in Switzerland and published in 2018, which uses five parameters to predict late onset seizure or post-epilepsy. The S stand for the, I think S is the severity of the stroke, and you have early seizures as well as one of the variables in the model. Large artery disease, one of the variables that account in the model too. Cortical location is one of the variables, and the last one is the MCA territory. So all those factors combined will help providers or physicians predict the risk of late onset epilepsy or late onset seizure or post-epilepsy. Now, having said that, the models has been developed in several cohorts and has been updated to include variables such as in early status epilepticus. There's one other update that was made that includes electroencephalographic variables as well. This is a SELECT model. Beside the SELECT model, and more recently, there's one model called the Ischemia model that was developed by a team in Birmingham in Harvard, and what they did in that model that was different from what the SELECT model did was to include a variable that will account for the hemorrhagic transformation. Remember, we said earlier that having hemorrhagic transformation will has a very increased risk of developing late seizure that significantly. The next step will be to integrate variables such as the patient genetic or patient genetic predisposition, or include variables such as cerebral microbleeds. So these are two models that we currently use to predict late onset seizures after ischemic stroke. After hemorrhagic stroke, there have been models that were developed, and the one that is probably the most popular is called the CAVE model. But the CAVE model needs to be improved, and we really need to develop new models for post-hemorrhagic stroke epilepsy.